Welcome back to the program. Today, my guest is Dr. Iman Sadri, a practicing dentist for over 15 years. His number one passion is teeth whitening and bringing back the smile to all of his patients. His latest book, Why Teeth Are Like Diamonds, is now available on Amazon. His procedure is so popular, Dr. Iman flies his patients in from outside the country to visit him for his Kor teeth whitening procedure. Let's learn more from Dr. Sadri himself. Welcome to the show.
Thank you, Andy. Thanks for having me.
Dr. Iman, can you tell us more about your teeth whitening system and how it has helped bring back the smiles on hundreds of your patients?
Yes, so thank you again, Andy, for having me on. The Kor teeth whitening that we do is a very meticulous system that was researched and cultivated over 50 years by Dr. Kurthy, who was a chemist and dentist. So the chemistry behind the actual teeth whitening product is superior and basically second to none because of the science that goes into it. It's shipped refrigerated, so the whitening gel is always cold. The patient gets it in the cold pack. They get it shipped from a refrigerated kind of manufacturing site, and when they get it home, they literally put it in the fridge and keep it in the fridge until they use it. That's part of it, but also the trays that come with the Kor whitening system do not allow any saliva to get it. And, a lot of people might have whitening at-home trays, but they're very generic and not as detailed and meticulous. And their lab technicians at the Kor lab really spend a lot of time making those trays. So it's a combination of those two factors that really make this an efficacious product.
What makes the science of Kor whitening different from other teeth whitening systems?
It's a great question. So part of it is the refrigeration, but I've also used other generic whitening systems and put them in the fridge to see if they have the same efficacy. So it's not just the refrigeration. The science also is to the fact that the carbamide peroxide formulation doesn't have any anti-saliva fillers. A lot of these other whitening systems have a bunch of other components. It's not pure peroxide that's to the degree where it can remove the most stains at the most kind of optimum pH as to how the whitening actually works by free radical release. So the Kor system, the whitening gel, because of the 50 years of the chemistry research behind it, they were able to optimize the formulation for maximum stain removal.
Does the Kor whitening system cause any sensitivity or damage to the teeth?
Yeah, also a great question. Less than 5% of patients have what are called zingers for about a week or two during the whitening process, and that's literally less than 5 out of 100. And that literally is just a little bit of cold sensitivity that dissipates within 5 seconds. There's zero long-term sensitivity with any of the hundreds of patients that I've done over 15 years with this system. I've even had patients with a lot of massive gum recession who've done this whitening system, and they've experienced no long-term sensitivity. And as far as damage to enamel, it's a carbamide peroxide at-home system, so it's different than the in-office whitening that we do. The in-office whitening we actually do after at-home trays are worn, and that's a hydramide peroxide, and that is potent, and that's not for everyday use. So doing in-office whitening can definitely damage the teeth if people do it too often. But the at-home whitening system, in fact, peroxide gel was designed to remove plaque and tartar. That's how they stumbled upon teeth whitening. So at a low level, it's actually good for the gums. And there's a lot of systems now that dentists use to keep the patient's mouth clean with periodontal disease with low-level peroxide gel. So it's really on the contrary. It really depends on the potency, but for the most part, no.
How long does the teeth whitening last, and what is the maintenance required?
Yeah, also a great question. The way I look at it, teeth are like a carpet or literally like a white shirt. Anything that stains a white shirt will leave a stain called a chromophore in the enamel or even deep within the enamel, sometimes beyond it. And so the maintenance depends on the patient's lifestyle. If they're drinking a heavy amount of red wine every night and really any kind of foods that stain the teeth, that's why people say like strawberries are good for whitening. So I've heard that online. That's complete fallacy. That actually leaves a lot of stains. So around once a month, I recommend patients to wear the system about 2 nights in a row for a touch-up. So around that time frame, about 1 weekend a month, the teeth come back to kind of great luster based on that type of maintenance. It's around that pretty much for average population.
Where can patients find you?
Great. Yeah, so they can look up SoCalTeethWhitening.com and make a one-click appointment on our website, and also I can be found online at Dr. Iman Sadri. And I do the teeth whitening actually at 4 locations in Southern California, but mainly at Newport Beach at PCH Med Spa. And if they're in LA, I have a location in Beverly Hills. Also once a month I'm there. Also South Orange County in Lake Forest, I'm there as well. But mainly at Newport Beach. And at the PCH Med Spa, we do a lot of other services as well, where patients will be happy to hear about.
Thanks for being part of the show today.
Thank you very much, Andy, for having me. I really appreciate being with you. It's a great honor.
And that's our program for today. Thanks for watching. See you next time.